cigarette everywhere in the house. So if you start to imitate, don't know this is how that does it. You think it is some like a spoon or like a fork, they have to use it because it is present and the father or the mother use in front of them, so it is some, for them, it's something normal.
But saying that there's also, you know, like this is getting like in fashion, and we see now it's a habit. When you go excuse me, to a cafe, we see lots of ladies and lots of gentlemen go into cafes and smoking the shisha or the water pipe, and they say, well, this is only water and it's not dangerous.
Shisha is a 17 cigarette, number one. If you smoke cigarette in 2 or 3 minutes.
Yes.
But if you smoke shisha, it will stay 2 to 6 hours. So the problem not only, for example, you are exposed to 5,000 services in 2 minutes.
Yes.
Calculate, multiply 5,000 services in 6 hours.
Yes.
Number one. Number two, when you smoke the cigarette, you will finish in 2 minutes, but when you smoke this shisha, you will suck. So you need a lot of muscles on the face, on the cheeks, and this sucking power will destroy the lungs tissue, the elastic tissue of the lung, and day by day you have fibrosis, you have emphysema, and the lungs will become inflamed and inflated, and all the chest will become full of air, but you cannot get it back, and it will lose its function.
Well, I'd like to ask also, before proceeding with that, you know, since we talked about, you know, like muscles and, you know, like, they say also that cigarettes and tobacco is harmful for the beauty.
Yes.
How does it affect, you know, women? How does it age the skin?
A lot of girls, like this girl, for example, this in Canada, they think that shisha is better than,
yes,
especially in the Islamic world. For example, this in Pakistan,
yes,
and this in Iran, they say we not smoke cigarette, we smoke shisha. What they don't know, even this is in the Gulf.
Yes.
Okay, this new kind of shisha we invented in Egypt. We can use this. We are sending from this about 20,000 from Egypt to America yearly. We are exporting it now. See,
this is now the trend. You know, shisha is in fashion.
So how it causes? You see, this why this girl became like this and became all like this?
Yes.
Because it loses the elastic elasticity, it loses collagen.
Yes.
Collagen. Vitamin C is very important for collagen. Cigarette, tobacco smoke destroys vitamin C.
Yes.
And the problem of vitamin C, you don't have storing vitamin C in your body. You need it every day. So if you don't eat vitamin C, if you are eating little amount of vitamin C, and you produce, for example, 2 cigarettes per day, each cigarette will destroy 28 milligrams of vitamin C. So at the end of the day, you have 0 vitamin C. So your collagen will be destroyed, so you will become wrinkled, you will become older than your real age. That's why not only the skin of the face and the internal skin, the mucosa, and all the tendons on our muscles,
yes,
will become wasted, and also the bone, we lose our teeth, we have trouble in our bone, osteoporosis, we have trouble in the heart itself.
Yes.
Every tissue of us depends on collagen, and this collagen will be deficient because of the smoking. So that's why we say when you are massive smoker, try to eat a lot of vitamin C, not only lemon and orange and this, broccoli, kiwi or guava. This will give you more vitamin C, but the first step, be far away from the active smokers.
So, you know, when you go sometimes to restaurants, they just tell you, well, you know, smoker or non-smoker, but then when you sit, you know, like next to an area with the same, it's the same.
Not practical at all, because they are smelling before in the aeroplanes.
So it doesn't work, you know, like whether you're here or there, you're smelling, you're inhaling.
And the new research now in Egypt now, with the World Health Organization, we discovered that 71% of the Egyptians are passive smokers in their houses. 80% of the Egyptians are passive smokers in the transportation means. For example, the buses like this, 50% of the Egyptians are exposed to passive smoking inside the hospital.
Does that explain that now the kind of accelerating rates of cancer that we are perceiving in Egypt?
Yes.
We did not have that before.
Yes, and also we say, please protect our environment, keep the environment clean.
Yes.
The first environment we are exposed to is the uterus. Now the uterus is destroyed and polluted by tobacco.
Even tobacco means the uterus of a non-smoker or passive smoker.
I have photos, I have films for fetuses. They are crying from the fetal smoking. And when the fetus, when the baby inside the womb, inside the uterus smoke because of his mother or because of his father or some of the visitor smoke in front of the mother, the aorta is the biggest artery, the big pipe which is giving blood and oxygen to every tissue of the baby will constrict for 15 minutes after each smelling of the smoking. So each tissue will stop growing, will stop moving. So each smoking of the mother, for example, for 1 cigarette per day, for the whole time of pregnancy, 1 cigarette per day will decrease the weight of the new baby by 20 grams. That's why the new generation of this smoker, you will find them very little weight, they are found small, and you have them, for example, like this, look, congenital malformations from smoking.
So the mother does not know how fatal it is affecting her own baby.
They will have asthma because he looks.
So the baby will just be born with asthma. With asthma, he will be an addict.
Yes,
it becomes
number two, will have hypertension, and they know that this smoking will affect the DNA, especially of the males. So the child and his generation and grand generations will have more disease and chronic diseases compared to the others.
Yes.
See also this asthma, they have also allergic rhinitis, allergic conjunctivitis. They will have very common because this will destroy the antennae, they will cause the mucosa of this eustachian tube from the mouth to the ear. They will have middle ear troubles, otitis media. See, they are crying a lot. I don't know why they are crying. They will say from the milk, the infection. No, because they are exposed to passive smoking. All of these are victims.